The Children's Hospital Association and the American Academy of Pediatrics are calling on President Biden to declare a health emergency due to unprecedented levels of respiratory and flu infections. A Biden official says the administration is, quote, ready to provide assistance to communities who are in need of help on a case-by-case basis. Here to react is Fox News medical contributor, Dr. Marty Makary. So, doctor, welcome. And let's just get right first into the RSV situation. Many people believe that immunities have been suppressed, that people's immune systems have been suppressed because of the vaccine. Do you think that that is contributing to this situation with RSV?
I do, Rachel, and a lot of doctors believe in the concept of immunity debt. That is, when you're virus naive for a long period of time, when you're sheltered, your body's not getting that low level of viral exposure that builds immunity at a low level, and it may be subclinical. You may not notice it. So that's probably why we're seeing this massive influx of RSV and influenza and other infections right now, accounting for hospitalizations in children.
Is the federal government, the public health officials, are they saying that very clearly? This is because of the vaccine, or is this just something doctors know, but nobody is officially saying it because it's maybe politically incorrect?
Look, there's not a lot of support for saying something like that right now in the world of censorship and the medical establishment, but many immunologists have written about this, Monica Gandhi and others, infectious diseases specialists, and it's well known, the concept of immunity debt. So this may be one of the consequences of the lockdown that we've not yet measured, and we're seeing these hospitalizations in mass numbers right now. We're talking 90 to 95% of hospitalizations in children for infections are not for COVID. They're for other infections right now.
What is all of this doing to the credibility of public health and also the American Medical Association, the Pediatric Medical Association? You say their leaders are activists and they are disconnected from their members.
Well, the American Academy of Pediatrics lost a lot of credibility in being bystanders in the school closures and insisting that every child wear a mask for 2 years, covering their faces, and now we're dealing with a mental health crisis and lifelong learning loss. So many pediatricians have stopped paying their dues to the American Academy of Pediatrics. Remember, a survey showed that 40% of pediatricians in America did not recommend the COVID vaccine for young, healthy children. That shows the massive disconnect with the activist leadership of the American Academy.
Wow. Dr. Makary, you showed courage when it counted. I wish many of those doctors that aren't paying their dues had let their voices be heard when it actually counted. I want to move really quickly to another topic. Researchers say that there may be a vaccine for fentanyl, a drug that is 100 times stronger than morphine. Your thoughts on that?
Yeah, this is interesting research from Houston. There's actually this idea that if you give the vaccine, antibodies could develop to fentanyl, making the molecule larger, and then it cannot enter the blood-brain barrier and have as much of an effect. So this is interesting. It may make fentanyl a little safer. But remember, when you make drugs a little more safer, people push that risk level, and risk appeals to some people. That's why the best strategy is that no drug is safe, and we can't just sort of promote the moral hazard of a safer drug.
Yeah, probably the solution is to close the southern border where so much fentanyl is coming from. Dr. Marty Makary, my favorite truth teller in the medical establishment, or not really the medical establishment, but in the medical field. So thank you so much for joining us.
Thanks, Rachel.
You got it.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.